Yesterday on City News, we introduced you to Shola Serafina, an expectant mother from Brampton whose experiences with the healthcare system were so frustrating, she sought out a midwife late in her pregnancy so she could get the care she needed. Shola was able to find a black midwife named Salima Ama to take her on, but access to midwives in Ontario is increasingly challenging for those who want one. We asked Salima why.
I've been told so many times that it's a funding issue. You know, here in Brampton, when you have one hospital serving over 600,000 people.
There's no way that all of those women who need help are going to get the same level of care that Shola has gotten.
Well, that's right.
Salima co-owns Ama Midwives in Brampton. She opened the clinic because she saw that racialized women were underserved in one of Canada's most diverse cities. But her services are just a drop in the bucket compared to burgeoning demand. Salima says her wait list is extensive, months or years long for some. She says families have visited her in person, begging her to take their case, but she just doesn't have the resources to keep up.
Midwives save the government a lot of money. I mean, Shola had a home birth.
Right.
She avoided all the expenses of going to the hospital. And even in hospital, midwives cost hospitals less money because we have early discharge. We don't usually have to involve OBs and anesthesiologists, or, you know, even have to go to the OR and then have to bring in nurses and staffing and all that.
In Ontario, midwives are covered by OHIP, but even if residents don't have a health card, they can still receive midwifery care. Brampton has one of the highest birth rates in Canada, but mothers in Peel Region have access to fewer midwives than ever. Those in the profession have long been advocating for more funding and fewer restrictions in order to meet the extraordinary demand. One of the biggest restrictions, advocates say the profession suffers significantly from hospitals restricting the number of midwives who receive hospital privileges and the number of births they can attend. It prevents practices like Salima's from hiring more midwives, sorely needed in a growing population like Brampton's. You can watch Shola's journey with Salima, including the birth of her son, and follow the stories of multiple people struggling to feel welcome by Canada's healthcare system in the Veracity documentary Broken Normal, airing on City TV this Sunday, August 14th.